Hi, this is Dr. Dennis Hartlieb. Welcome to Cosmodent's free webinar series. Today's presentation is Reality or Resin, Direct Resin Veneers. So today we're going to go through the advantages of using composite as a veneering system instead of porcelain. And we're going to look at a couple clinical cases demonstrating how to use composite step by step to be able to create beautiful veneers for your patients. So what are the advantages of composite veneers? Well, I think almost always the resin veneers are more conservative in preparation than porcelain veneers. I don't have to worry about undercuts and I don't have to worry about insertion patterns as I would for porcelain veneers. What I really like about composite veneers is that I have all the control. And many of us who've cemented porcelain veneers or delivered porcelain veneers, sometimes there's that moment where the veneers aren't quite what you're expecting from the laboratory. They don't quite mimic the provisional restorations as much as what you would like. And so having the control is, I think, one of the biggest advantages of composite. What I really like also is there's immediate results. You can take somebody who has not very attractive teeth, and with composite veneers, there's an immediate transformation. With porcelain veneers, there's that stage in between where the patient has not very attractive teeth to when the porcelain veneers come in when you have the provisionals. So if you're like me, one of the challenges I have is that patients sometimes like their provisionals more than they like their final porcelain veneers. Their consciousness has been raised. They're much more aware. They start looking for issues with the porcelain veneers because now they've been able to live with these temporaries that are much nicer than what their teeth were before you did the preparations, did the provisionalization. Resin veneers, there's no temporaries. The patient's able to leave with the final results. Sometimes when we finish with our resin veneers, or sometimes with our porcelain veneers, the patient may not be ultimately satisfied. So what's great about composite is I'm able to make changes to the composite easily. If I do need to redo the veneers, then that's easy. I don't have to take new impressions. I don't have to send the case back to the laboratory. I can just take off the surface of the composite and redo the final surface if I need to. And that's just much easier to do than going through the whole porcelain veneer technique. What's also great about the composite veneers, there's no lab fee. So there's a decrease in the cost for the patient, which I think is one of the reasons why many of the patients choose to do composite versus porcelain in my practice. The advantage of porcelain is stronger. Because of its strength, it's a more durable restoration. But the great news about composite, if it does chip, it's easy to repair. Whereas if porcelain chips, that's a much more complicated repair. Very often it means redoing the entire porcelain veneer. So I tell patients that porcelain veneer, because of its greater strength, it should last longer. And I think the reason why most dentists do porcelain veneers, I tell my patients, is because ceramists, the lab technicians, typically are better at creating form and color than dentists. So I tell my patients, look, in dental school, what we're taught to do is to drill away tooth structure and take impressions and send the impressions to the laboratory. Ceramists spend their entire career learning how to rebuild teeth, how to create form. So once you learn those skills as a dentist, then instead of doing it in porcelain, we're doing it in bonding. And we can get as beautiful results as you can in porcelain, if not more beautiful. I used to tell patients that you could get more dramatic results with porcelain, but I don't believe that's true anymore. I think that you can get equal results or maybe even more dramatic results with composite, given the materials that we have available today. So the first technique I'll describe is called the inside-out technique. And then we also have what's called the outside-in technique. So let me describe that a little bit more in detail. So the inside-out technique is a technique that our lab technicians use when they're trying to build a crown or trying to build a veneer. And it's also a system that many of the composite manufacturers use for layering the composites. So essentially, what the manufacturers want you to do is they want you to ignore what the outside shade of the tooth is when you're rebuilding the dentin layer. That is, they want you to take a color that's more chromatic, that has more color than what the outside view of the tooth is. So your first layer when you're replacing the dentin layer is going to be this chromatic dentin that's going to be more colorful or darker than what the outside shade of the tooth is. So that dentin layer gets laid down first, and then over top of that dentin layer, then an enamel layer will be placed that's going to be more translucent, that's going to allow some of that chromatic dentin to shine through. And you need this sort of perfect marriage between the two materials so that you end up with the correct color at the end. So the great part about these inside-out techniques is that when they're done properly and when they work, they can look beautiful and they have great depth to the restorations. But the downside with this type of technique is it's a little bit unpredictable. And any dentist who have done this technique knows that it's difficult to know how thick to make that dentin layer, and are you using the correct chroma of dentin? Is it dark enough? Is it too dark? And when you put on your enamel layer, is it too thin? Is it too thick? Is it the correct translucent layer that you need to get the final shade? So while you can get some outstanding looking restorations, it's a little bit less predictable. Our first case we're going to look at today is Maya, who has a peg lateral at the right lateral position, number 7. What you'll also notice when you look at Maya's smile is that you see a lot of gingiva without the clinical crowns of the teeth being fully exposed. So in consultation with Maya and her parents, we talked about the fact that with leaving the gum tissues as they are for the bonding procedures, the clinical crowns of the teeth would end up being as wide as they are tall, and it would be an unaesthetic final appearance. And so what I recommended to the parents and for Maya was to have some aesthetic crown lengthening done so that we could expose the full clinical crowns of the teeth, so then we could give her the full effect of having the peg laterals bonded and create the proper color and contour and form and be able to have the correct tooth proportions when we did our bonding. So I referred Maya to a local periodontist, and she had full crown lengthening, so it's an osseous procedure, not just a gingivectomy, not something that was done with a laser. It was a full flat procedure where they had to recontour the bone and set the bone 3 millimeters from the CEJ. And so they were able to establish normal biologic width and be able to present the full anatomical clinical crowns. These photos are 6 months following the osseous crown lengthening, and Maya's done some bleaching to whiten the teeth a bit, and she's ready for us to go ahead and get started with the bonding. We're going to be working on teeth number 6 and number 7, the canine and the lateral. When you look at the lateral, you'll notice there's a little defect in the mesial, just an enamel defect, so we're going to have to address that at the same time that we do our bonding. But also, you'll notice that there's a considerable space between the canine and the lateral incisor. It's not uncommon for these kids who have these peg laterals or who have congenitally missing laterals, that the rest of the teeth in the arch, in the maxillary arch, are more narrow than normal. So it's not unusual that there's other space closures that need to be completed besides having the peg lateral veneered. So I discussed with the parents that not only do I need to treat the lateral incisors, but I also need to do a diastema closure on the canine. The final thing to notice is you'll see how pointed the lower canine is, opposing that space. So in our conversation we discussed that I'm going to need to do some smoothing or some rounding of that lower cusp tip, otherwise it's going to probably cause problems with my final resin restoration. So we will first start out by pumicing the tooth to clean it. You'll notice in the first slide that there's a retraction cord that's been placed. So I typically will place retraction cords just to help contain any of the sulcular fluids. Now I want to get access to that defect on that mesial, and I want to sort of create a more appropriate gingival profile in that proximal area. So I'm going to use a little electrosurgery. You could use a laser. I just need something to open up that tissue just a little bit so I can start to create a more normal, more natural emergence profile. So once that tissue's been recontoured, I'm going to go in with a micro burr. This is from Brasseler. It's part of their micro burr kit. And I'm going to go in and I just want to roughen up where that defect is. I want to make sure that I'm cleaning out any plaque, make sure that the area is abraded so that I can more easily bond to it. And then finally I'm going to use just a flame-shaped diamond burr just to abrade the surface lightly. You don't necessarily need to do any facial abrasion when you're going to be bonding straight onto the enamel like this. There's no preparation that's necessary other than in that little defect area. So this is essentially a no preparation restoration other than where that defect is, to clean that out to make sure that I can have great adhesion when I do my direct resin bonding. In the first image, you'll see that there's a piece of Teflon tape separating the central incisor from the lateral incisor. I did not need to protect the canine because it's far enough away. Even if I do touch that, I'm going to be polishing that surface. The first image shows placing the etch. Second image has the etchant already placed. We're going to leave that on for about 15 to 30 seconds. Because I'm dealing with a complete enamel substrate, I can go ahead and etch the tooth a little longer to make sure that I have great etching on that enamel. I'm going to follow up with Cosmonet Complete, their 5th generation adhesive, after I've rinsed and taken off the excess moisture from removing the etchant. The Cosmonet Complete is placed in multiple layers, air thinned and light cured for 20 seconds. So you have several materials that you have to choose from in dentistry today for doing your composites. Many people still use the microhybrid composites, but more recently people are using the nanofill composites. The nanofill composites were really meant to replace our microhybrid composites. That is, it gives you the same strength or similar strength as the microhybrids, but a better polish and better wear. The third material, which I think is critical for doing any anterior bonding, are our microfills. Now, what are the difference then between those three composites? Well, they can be separated based on strength, and as I said, the microhybrids and the nanofill composites are very similar with their flexural strength and their compressive strength. The microfills fail in their flexural strength. That's the biggest problem with the microfills, is that if you leave the microfill unsupported on the edge, patients, through biting their nails or through excursive movements, they could chip off that microfill. So the microfills have to be protected with either the microhybrid, the nanofill, or with natural tooth structure. So the microfills actually have the best wear resistance of all the materials because of their small particle size. And because of these incredible small particle size of the microfills, they polish the best of all of our composites. And the polish that you get with a microfill should rival what you can get from porcelain. The nanofills do polish better than the microhybrids, and they do maintain their polish a little bit better also. So the nanofills do give you that advantage over the microhybrids of having a better maintained polish with a similar strength, but they don't polish as well as the microfills, and they don't maintain their polish as well as the microfills. What I also like about the microfills for an outside surface or for the enamel surface is that they have great translucency, where I can get more opacity with my nanofills and my microhybrids. I can use their opacity to help block out shine through for like class 4s, or if I'm adding incisal edges, or for blending into tooth structure. My microfills are going to tend to be more translucent. It's going to allow more light to come through, which is going to give a much more natural effect to those materials. The final issue with to consider when selecting your composite materials is they have difference in their fluorescence. So teeth have a natural fluorescence to them. The enamel is much less fluorescent than the dentin is. Now the fluorescence is important because the fluorescence gives a natural vitality to the teeth. And so it's not just about going out to nightclubs and the black light effect. Just in natural light, there's a vitality that occurs from this natural fluorescence. So with our microfills, with the Cosmonet's Renamel microfill, the microfill fluorescence is very similar to the enamel fluorescence found in nature, whereas the nanofill fluorescence is more similar to the dentin, a more fluorescing agent, much like the dentin is. So I like to use my microfill and my nanofill in a layering technique where my microfill will be used as my enamel surface, which will then have the nanofill underneath. So I'll have sort of this dentin of my nanofill, and I'll have my enamel from my microfill. So I'm going to use a little sectional band. This is a band that I used. This is from a company called Howe, H-A-W-E. It's a clear sectional matrix band. I place that matrix band so it's between the retraction cord and the tooth, so it sort of seals the band cervically. And I'm going to take a little of my nano composite and I'm going to start building up that emergence profile using a little bit of nano composite, using the band to help control that contour. Once I place that in, I'm going to light cure that. And then in the first image, you're going to see that I built up a portion of that mesiolingual wall. Now I want to keep that nano composite to the lingual. I don't want to bring it around to the facial because I need room for my microfill, which is going to be my enamel layer of material. Now you'll also notice that I'm bringing my nanofill composite directly in contact with the central incisor. You'll notice there's no wedge, there's no mylar strip in between the teeth. Because I protected that central incisor with that Teflon tape, I can build my composite directly to that distal wall of the central incisor, and I don't have to worry about that I'm bonding that composite to that enamel surface. This way I get the contour that I want, and I get an excellent proximal contact. If I place a wedge and I put a mylar strip in there, I'm limited by the dimension and the contour of the mylar and the thickness of the material. The enamel nano is filled in that mesio-proximal wall. It's created that lingual incisal wall, and it's extended out the distal as well. So in this case, the enamel nano has created the substrate for me to go ahead and layer my microfill over the surface. But before we can do that, I need to talk to you about opaquers. You can see where the composite ends and where the tooth begins if you look from the incisal. And that's quite often one of the problems we have when we're doing our direct composites, is you get that shine through where the composite is not opaque enough to block out the back of the mouth, and you can see that transition where the composite ends and where the tooth begins. So to overcome that problem of the shine through, we need to use our opaquers. Now opaquers, they're a composite based material, and we use our opaquers to help either A, block out underlying stains, or more commonly with restorations like what we're working on today with Maya, is to help block out that shine through because our composite is not as opaque as a natural tooth structure. And we use these opaquers to blend the composite onto the tooth structure so our restorations are seamless, so you can't see where the restoration begins or ends. You can't tell that the tooth has been restored. In the clinical images that I'm showing in this slide, you'll see this is actually a preparation for a full crown, but you can see that dark substrate. So by using an opaquer, I'm able to block out that color, so when I take an impression, it'll be much easier for my ceramist to be able to create a translucent crown without having the effect of that dark zone shining through. And so I can control that and make it much more predictable for our final crown and bridge work as well. So in the first image, I'm showing that I'm placing the opaquer on the composite and just gently blending it on to the enamel surface. Now remember, the tooth structure itself, it's opaque enough. So I don't want to opaque the tooth structure. What I want to do is I want to opaque the composite so it's at the same opacity as the tooth structure. Okay, so you will place these opaquers in thin layers, and they get light cured, they get polymerized because they're a composite based material. I recommend you place a thin layer, light cure for 10 seconds, and then I'm going to teach you a trick. What I do is I'll squint. And what squinting does, it reduces the effect of color vision in your eyes. So it reduces the strength of the cones that are in your eyes, and you depend more on the rods, which are more black and white. And what this does, it allows you to see value. So by squinting, it allows you to see, do you need to add another layer of opaquer? And I recommend, it's easier to add another layer than if you over opaque, then you have to drill away that excess opaque because you don't want it to be more opaque than the natural tooth. So the first image on the left shows after the nano's been completed before we opaked. The second image shows with the opaquer in place and light cured. And if you squint, you should not really be able to tell the difference between where the composite is and where the tooth is. It should just sort of look the same brightness, the same value, not be able to see that shine through. So, to add more natural characteristics to our resin restorations, we're going to be using some tinting. So, the tints we can use to add colors, we can use to help create effects like hypocalcifications or decalcifications. We can use different tints to help create more translucency effects or create more warmth in our restorations. So whereas opaquers are blocking out color, we're actually using tints to add color, to give vitality, to give more natural effects to our teeth. So my recommendation when you're doing tinting, if you're just starting out, it is better, let me say that again, it is better to under tint a tooth than to over tint a tooth. I've never had a patient who told me, Dr. Hartlieb, I wish you would have tinted this tooth more. So use them very cautiously, and the microfill composite that goes over top, it really magnifies the effect of your tinting. So I show in this first slide that I'm using some white tint. That's too intense. I'm actually going to put that on. I'm going to clean my brush and then take away some excess. I show using a little gray tint to heighten some zones of translucency, and I'll even use some ochre tint, or what Cosmonet refers to as light brown, and I'll use that to give a little bit of warmth in some areas and to help maybe create more the Denton tips effect, if you will, if you're trying to create that effect. And again, it's better to under tint than to over tint. Now, those are also cured. Those are polymerized for 10 seconds. Now I get to put on my final layers, my enamel layers. Now to create more chroma in the restoration, I'm going to be using a different microfill at the gingival than I will through the body material. But what are our advantages of our microfill? The microfill gives us our most polishable composite out on the market. It should polish like porcelain if you follow the techniques that we'll talk about today. What's also great about microfill is they maintain their polish. When patients come back for their hygiene visits, the teeth look shiny. You've all experienced this where patients come in after you've done bonding on their front teeth using either a microhybrid or a nanofill, and they have lipstick that sticks to the composite. It doesn't look shiny. We've all experienced that, and it's not based on any manufacturer. It is just a reality of the particle size issues with both microhybrids and the nanofill composites. And I think the microfills give us the most enamel-like material that we have. I think it's more enamel-like than porcelain. I think it's so chameleon with the tooth structure. It blends in so naturally that the enamel, when it's polished properly, it just disappears on the tooth structure. The disadvantage of microfills really is that it doesn't have the flexural strength that the microhybrids and the nanofills have. So they have to be supported. These microfills must be supported either by the hybrid or the nanofills or by natural tooth structure. And again, we only use the microfill only on the facial surface. So in the first image, you're going to actually see that I'm using a translucent or an incisal shade of microfill. This is the Cosmonet's Incisal Light. And I want to create more translucency in that incisal third to mimic nature. And what that's also going to allow is for those effects, those staining effects that I've placed, to sort of come through that and look very natural. That will be light cured for 10 seconds. Then I'm going to take a microfill that's more chromatic. This is the A1 microfill from Renamel. And I'm going to place that at the gingival third so I can give more chroma to that area of the tooth. That also gets light cured for 10 seconds. Finally, one of my favorite shades from Cosmonet is what they call their B0. The B0 corresponds to the 1M1 on the expanded Vita shade guide. So it has a nice bright shade to it which blends in very nicely to people who have bleached their teeth. What I like to do is I roll this final shade of my enamel microfill, roll it into a ball, and I'm going to place it in the middle of the tooth. I'm going to start spreading that microfill over the entire surface. So it's actually going to go over that A1 in the gingival. It's going to go over that incisal material, that incisal light that I put towards the incisal. I start out using this instrument called an 8A, and then I'm going to change to an IPC instrument which will then allow me to blend in more ideally and be able to create the contours that I'm looking for. When I'm finished with the restoration, contouring the composite, I will light cure that for 60 seconds. After the composite is light cured, one of the things that we need to talk about as you're building up your restorations, you want to be sure to look from the incisal, not just from the facial. And you want to make sure that you maintain and create your line angles, your mesial line angle and your distal line angle. Those line angles help visually separate the facial portion of the tooth from the proximal surfaces. So you want to be certain to create those while you're forming your composite, and you want to evaluate that from the occlusal view. The first instrument I'm going to use for contouring is what's called the ET9 from Brasseler. It's a carbide fluted burr. I'm going to use my carbide burr without water spray. I want to use it dry because as I start working my carbide burr, I'm going to start looking for areas where the composite dust settles onto the tooth structure. That area where the composite dust is settling is actually showing me where the composite surface is not yet smooth. So I want to be able to remove any of those surface defects, and the best way for me to be able to see those surface defects is look for those white lines or those white patches where the composite dust is settling. With my slow speed, I'll go in and I'll start to use my flexi disc. This is the coarse flexi disc, and I'll use that to help again establish sort of this primary contour, primary anatomy to the facial surface, but I also use it to smooth off the incisal edge and create the proper incisal length that I need for my veneer. Before I complete the contouring and polishing of the lateral incisor, I want to build up the canine. So before I can build up the canine though, I have to polish the proximal surface of this resin restoration that I just created. So I'm going to use the flexi disc, starting out first with my blue disc, which is the medium coarse disc. Then I go to my yellow disc, which is the fine, and then finally the pink disc or the rose disc, which is the super fine. So I want to make sure that that distal surface of the composite restoration is highly polished, because when I start to do my canine, I'm going to build my composite directly to that composite wall that I just built on my lateral incisor. And as long as that composite is completely polished, I can build my new composite right to that surface and it won't bond to it. I'm going to etch my canine. There's no preparation on the canine. I've pumice the tooth to clean it, and now I'm going to place my etchant. Because the tooth has not been prepared, I have to etch the tooth longer than if I've roughened the tooth. So unroughened enamel you need to etch for 30 seconds, and I would definitely not use a self-etcher in this type of situation because self-etchers do not etch well on unprepared enamel. You'll notice I'm etching the entire tooth surface because when I finish my microfill composite, my enamel surface, I'm not quite sure where I want to extend my microfill surface, but it has to be on well-etched tooth structure. So after I rinse off my etchant and I place my adhesive and light cure, now I'm going to place my first layer. So in this case, I'm going to place my nano composite first to start building that mesial wall. That mesial wall is going to be built directly to the composite on the lateral incisor. And here I show using my multi-purpose instrument. The multi-purpose instrument is helping to make sure that I don't overbuild that nano composite facially, that I'm leaving room for my microfill composite. This shows with the final build up the nanofill composite and looking from the occlusal to be certain that I'm leaving space for that final enamel microfill layer. So here I am using the same shade of opaquer that I used for my nano composite. So my nano composite was an Vita A1. So now I pull out my creative colors from Cosmonet. This is their A1 blends right to the Vita shade guide. This is what it looks like magnified. After I place my opaquer and I light cure it, then I can go ahead and start placing my tints again. So I have the same similar effect. You can see the hypocalcifications on this tooth on the distal corner and on the middle third of the tooth. So I want to add some of that hypocalcification so the restoration is seamless with the rest of the natural tooth. After I've cured my tints, Then I'm going to again place my incisal layer so I get more translucency. This is the incisal light microfill. I'm going to place that in that incisal third. I'm going to light cure that, and because the canine is more chromatic, has more color than the lateral incisor, I'm going to use the A1 microfill for the entire surface. I'm not going to use the B0 because I want it to blend. The B0 would be too bright for the canine, where it was the right shade for the lateral incisor. So using my IPC instrument, my interproximal carver, to blend the microfill to the enamel. And when you're doing a diastema closure like this, we're working on unprepared enamel. So the key is you want this microfill to blend in smoothly and seamlessly to the enamel. So just by using a clean titanium coated instrument like this from Cosmodet, you're going to assure yourself you can get a nice smooth interface between the composite and the tooth structure. And after final curing, that's what the microfill buildup looks like, with the nano reinforcement, the opaquer to block out that shine through, and then a little bit of tint that's going to come through as we start doing our contouring and polishing. We follow the same protocol for the canine that we use for the lateral incisor, using the ET9 burr and the coarse disc to start to create the contour. I'm going to use this 8392-016 burr. It's a little mosquito burr from Brasseler to refine the gingival margins. And then I follow those gingival margin contouring by using the flexi cups, first the blue and then the pink, to ensure that I have a very smooth interface between the composite and the natural tooth. It's important that when you're using these cups that you actually spray water while you're using these cups, because these cups can exert a lot of heat. So my assistant sprays water and suctions while I'm using the cups. Then, to define my final contours and to create the final surface that I want, I'm going to go back to the flexi disc. This is the blue disc. You'll notice the flex on the disc. That's very important. You want to get as much of the disc onto the tooth surface or the composite surface as possible. That's how you get the smoothest surface and you get the best shine. So what I like to use to create an enamel quality surface to this microfill is I like to use what Cosmodet's Flexi Brush Point. And I'll use the brush, this is an aluminum oxide point, I'm going to use the brush to create sort of a lightened surface texture that tends to blend in very well with natural teeth. Following using the Flexi Brush Point, then I go in and I follow up with my final polishing discs from the Flexi Disc System, first the yellow and then the rose. And then I'm going to finish that up using the Enamelize, which is an aluminum oxide polishing paste, with the Flexi Buff System from Cosmodet. And on the left screen you see the full smile before the crown lengthening and before the bonding, before the bleaching and the bonding. And then on the right side you see the smile after. So we've done full veneering on both lateral incisors and then the diastema closure on both the canines. With the retracted view closed up, you see the bonding on the canine should just disappear. You shouldn't be able to see where the transition is between the composite and the tooth surface. You should be able to note the quality of the enamel-like appearance of the microfill, the shine of the microfill. You can also see some of the effects coming through, especially on the lateral incisors, those hypocalcifications. Now the second case that we're going to share with you today is what I refer to as our outside-in technique. So with the outside-in technique, I ignore the fact that the dentin is going to be more chromatic than what it appears through the tooth. So I'm going to take an outside shade of the tooth. So let's say that this tooth is an A1 shade tooth, Vita shade A1. I'm not going to use a darker dentin shade. What I'm going to do is I'm going to use the shade of composite that corresponds to the viewed shade or the outside shade. So in this case I would use a dentin shade that's A1 to match with the tooth color. And then over top of that dentin A1 shade, I'm going to use a more translucent enamel shade also of the same shade, also A1. So the advantage I have by using my dentin shade of A1 and my enamel shade of a more translucent A1 is that when I finish, I'm very confident that the shade of the restoration is going to be A1, which is the desired shade to match with the tooth. The downside of using this outside-in technique is that we need to make sure that we create some sort of depth to the restoration. So very often we're going to have to use some sort of tinting or some sort of staining to create some sort of depth so the restoration doesn't look monochromatic. But otherwise, I think you get a much more predictable shade to the restoration, and it's going to be much easier to blend that to the natural tooth. All right, so let me introduce you to my young patient here. She presents post-orthodontics, and you can see that she has some interesting canine appearance. You'll also notice that the lateral incisors and the central incisors are set back from the arch, and the canines are very intense. So the patient and the mother are looking to have a nice smile appearance with as minimal tooth structure removal as possible. In order for the orthodontist to get some occlusion, he's actually sort of brought in those maxillary anteriors, which is why they're not in the full arch form as what we would like to see. So the nice thing about this is that we're going to be able to do completely additive dentistry. There's only going to be one area or a couple areas where we have to do some tooth removal, and I'll explain that as we go along. So if you look at the center screen, the center image, you're going to see that there's some intense hypocalcification with the right central incisor. My concern with that is, and it looked more intense in person than it even shows on the image here. I was afraid that if I don't do something to block out the intensity of that hypocalcification, or the fluorosis, whatever is causing those white stains, it was going to shine through my veneering. So we're actually going to do something to mute that intensity, and we'll walk you through that in just a few minutes. Here's the occlusal view. With the occlusal view, you can see that the laterals and the centrals are inside the arch form. So that really gives us a great opportunity to be able to do just strictly additive dentistry. We're not going to have to prep back any of the tooth structure. So the first thing that I'm going to do is I'm going to use a football diamond burr to remove some of the tooth structure where that hypocalcification effect is. What I want to do is I want to block that out so that I can get tooth number 8 and tooth number 9 to look identical. So that's the key when you're doing veneering of multiple teeth and you're working in that anterior zone. The key is you want the two central incisors to really be very symmetrical, both in tooth form and shape, but also in color and in translucency and opacity. So I'm concerned that if I don't do something to block out that hypocalcification, the central incisors are not going to look the same when I finish. There's also some just light reduction on the facial surface there, and that's just meant to blend in since I'm creating sort of this divot in the middle third of in that incisal third of the tooth where that hypocalcification is. I want to just sort of blend, so I'm using just a fine diamond burr just to get a little blend of that surface. If you look at the left side of the screen, you'll notice there's a bit of a mesial cant to the smile. So it cants from left to right. So I want to create a straight axis for that midline. So I'm going to use this little diamond disc from Brasseler to open up the contact between the two central incisors. It's critical that you open up this contact. If you try to correct an angulation issue without opening the contact, it's going to be difficult for the patient to be able to get in with floss, and it's never going to look quite right. So when I do veneering of the anterior dentition, and I'm going to be doing essentially a smile makeover, I want to veneer the central incisors at the same time. So you'll see I've taken some plumber's tape or Teflon tape, and I've protected the laterals from the central incisors. But I'm going to etch and put the adhesive agent on my central incisors at the same time. So they're etched, the unprepared enamel for 30 seconds, prepared enamel for 15 seconds. I rinse off the etchant, leave the tooth moist. I'm going to put on my Cosbident Complete, my 5th generation adhesive system, and light cure that. Now, as I'm doing my central incisors at the same time, the key is I'm going to build them up step by step at the same exact time. So the first thing I want to do is start to build the incisal edge position that I want for the final restoration. So I'm going to create essentially a little ledge of nanofill composite that is going to then be able to protect the microfill composite when I layer that in. So creating the proper length using an IPC instrument. You'll notice though that I'm making sure that the composite between 8 and 9, that nanofill composite, is not touching each other. So I'm keeping the teeth separate. So where I had to prep back on number 8 because of that hypocalcification zone, it's still there. You can still see some of that hypocalcification, but I want to block it out some. So I'm going to use the nanofill as an opaquer. So I take a little nanofill and I'm going to fill in that divot that I created in that right central incisor with the nanofill composite. Now when I finish placing my nanofill there and I light cure that, I can still see some of that intensity of that hypocalcification shining through. So if I want to block out that hypocalcification from shining through, what do I need to use? I have to use my opaquer. My opaquers are meant to block out that underlying shine through and that underlying color. So I'm going to use the opaquer the same shade as what I use for my dentin shade. So if I'm using A1 for my nano, I'm going to use A1 for my opaquer. I'm going to paint that on in thin layers and light cure to make sure that I can block out that hypocalcification from shining through. It's critical that the two central incisors look identical in space. So that's why I build them up at the same time, because I want to make sure that from facial to lingual, I'm building them out equally and that they're in the same space, so that when I add my final microfill layer, I'm virtually guaranteed that the shade and the color are going to be identical. Okay? So we light cure our opaquer, and now I want to start adding some color. So I'm going to use some of this ochre or this light brown to the gingival third to add some warmth. I'm adding a little bit of white to create some natural hypocalcification because we are blending this into the rest of the art. The canines and the bicuspids and the lower teeth, they have hypocalcification, so I want to give some light hypocalcification to blend that in. I'm placing a little gray tint in the incisal third to create a little translucency effect. So after the tints are cured, now I'm going to place some incisal microfill in the incisal thirds. And first I'm working on the left central incisor. I want to blend that incisal composite into the tooth so it's a nice smooth transition. Once I begin with my microfill, I want to work with one tooth at a time. So in this case, I place my incisal microfill on the other incisor. You'll notice that the both incisal thirds are built out with my incisal microfill. And then I'm going to start using my same shade of my microfill that I used for the nano composite. I'm going to be using over the facial surface. So my entire facial surface is built out, and to make sure that I've sealed up in the cervical extension, I'm going to place a little bit more of that A1 microfill and blend that in to make sure that I've completely sealed in that cervical margin to offset any shrinkage I may have had when the composite was curing. So the left central incisor is completed. The right central incisor has the incisal microfill, but not the facial microfill, the rest of the facial microfill, the A1. So here's the key. I want to build my second veneer directly to the other central incisor on that mesial. So I have to polish that contact, just like what we did in the previous case. So I'm going to use a diamond strip first to get in and make sure that the surface is nice and smooth. Then I go in with my composite flexi strips from Cosmodent. The flexi strips come in 4 different coarseness. I usually just use the yellow and the pink after I use my diamond strip. I want to make sure it has a super shine, a super polish, so it's actually going to be squeaky clean. You can literally hear it squeak as I'm polishing the surface. So with that mesial contact polished, I can then put on my A1 microfill over the entire surface, blend it directly onto the other composite because it's polished on the mesial of number 9, and then I can do a final cure Then I can go on and I can polish the distals of the central incisors, and I can build up my lateral incisors the same way I built up my centrals. Now, before we go into the finishing and polishing techniques, I just want to discuss what I needed to do with the canines. Because those canines were so bulky, these were the teeth that I really had to prep. Otherwise, as I explained to the patient and the mom, if I don't bring back some of that canine, the canines will, in the final smile, be too bulky. So I had to remove some of the bulk of the canine, but the nice thing with these canines, there's plenty of enamel, so it's an intra-enamel preparation. So the final canine preparation, you see, now allowing space for the full veneer, but ultimately we had to do preparation on the canines because of how bulky they were to create space that we need for the resin. So this is after the composite is initially built without the contouring and the polishing. The contouring and polishing, we go through the same steps as we discussed in the first case. We're going to start out with using our ET burrs, our carbide burrs, dry. After we use our ET burrs, we'll follow up using our Flexi coarse disc and then the medium coarse. Then I'll use my Flexi brush flame to create some of the natural surface texture, and then finish up with the yellow disc, the fine, the super fine rose or pink disc, and then our enamelize with our little Flexi buffs. So this is how we started. And then with our smile, being able to bring out the smile, being able to create natural tooth form, being able to remove the bulk of those canines, be able to create natural incisal embrasures, and be able to get the central incisors so they mimic each other, both in contour, shape, and final color. And you can see the luster that we're able to achieve with the microfill composite, the translucency effect, and again using one color of composite, this outside in approach. We're using the viewed shade, what we want for our final shade. We're using the nanofiller microhybrid as the base. We're using the microfill the same shade as what we use for a nanofiller or a microhybrid. Using an opaquer as needed to help block out any shine through. Using colorants, it's really important to use these tints to be able to create natural effects and natural color. Otherwise, you'll end up with a very monochromatic restoration. Well, I hope you found that this webinar was helpful and these tips on creating success for your practice with direct resin veneering. If you have any questions regarding the techniques or the materials that I used today, the best way to reach me is through my Facebook, which is called Hartlieb Aesthetic Seminars. I'm going to be holding a hands-on course at Cosmonet's Teaching Center in Chicago, right on Michigan Avenue. It's a 2-day course. It's based on all direct resin restorations for the anterior and then also for the posterior, for doing direct posterior restorations that are predictable, that blend in with the natural tooth structure, and that are easy to do. If you're interested in learning more about that, it's on April 10th and 11th. You can contact Cosmonet and find out more about that course. So thank you again for spending your time with me, and I look forward to hearing from you on my Facebook, Hartlieb Aesthetic Seminars, or hopefully see you at the course to get some hands-on experience using these wonderful materials from Cosmonet. Look forward to seeing you soon.